Good morning, folks. Happy New Year. It is January 9th, 2026, and this is Coffee with Community Services, Alta California Regional Center's weekly service provider meeting. Thank you so much for joining us today. We've got 73 folks on. I'm going to get into our introductions real quickly and then do our agenda. So we have from Client Services, our manager, Toby Golden. Good morning. We have from Community Services, Allison is on. Our manager, Michelle, is on. We have Shauna and Virginia and Janice and Tom as well from Community Services. We've got our manager, Helen. We have Ebony, and I will ask Ebony's supervisor to actually introduce her real quickly.
Yeah, thanks, John. I wanted to introduce Ebony Maldonado. I'm going to let her give a little background. She's been with the Regional Center for some time, and she'll be working on residential services. Go ahead, Ebony, if you want to introduce yourself.
Hi everyone, I'm Ebony. I've been with the Regional Center for about 4 years. I started off as an adult service coordinator, and then I moved over to the residential unit as a liaison support coordinator, where I conducted Title 17 reviews. And now I'm in CSS for residential under Michelle.
Welcome, and service providers, you'll certainly get to know her on the residential side. But thank you, Ebony. Awesome.
Thank you.
We also have another person, Michelle, as well. Sammy.
Yeah, Sammy Lynn, I'll let you introduce yourself. Sammy she's been in the community services department in another unit, and she will be working on our ILS and our coordinated family supports and payee service. Go ahead, Sammy.
Hi, everyone. I'm Sammy Lynn. I used to be the Vital Records Office Assistant in the Quality Assurance and Compliance Unit under Scott Barr, where I help facilitate the mortality review process and work closely with the SIR desk. And now I've moved into this community services specialist role under Michelle, and I'll be working with, like Michelle said, ILS, CFS, and payee services. And I'm just excited to connect with all of you and collaborate with our amazing vendors.
Thank you. So watching one of our community services staff get promoted is like one of my absolute favorite things. And being able to keep all that regional center experience with us. So congratulations, Sammy. Welcome, Ebony. And additionally, we have on Christine and Yvette and Alicia. Welcome back from vacation as well. From and Alejandra and Jessica and Dan from Community Services. Additionally, we have our manager Jordan on. We have Michael Mercado on, who you're going to hear from next. We've got Damien and Chris and our employment specialist Carly on. We also have Kylie and Beverly and Brandy and Rhonda from Community Services. We've got Jolana. We have Community Services alumni, Client Services Manager Jason Scantleberry on. Another promotion that we are all very pleased about. And we've got, additionally from Community Services, Mason is on. We've got Christy. We've got Wason. We have, is that Isabella down there too? We've got Isabella. And then we've got Hubert and my assistant, Zach, as well. Good morning, folks. For our agenda today, we are going to do our Deaf Culture 101 and Sign of the Week. We are going to give an update on the budget that just got posted in the state of California. We're going to go over our new rates and rate implementation. We're going to share about our newsletter. We are going to talk about the HCBS directive and the Gen AI directive that came out from the department since we had our break-in meetings. We have a spotlight from Zeb Gill related to QSP. So they will be on, oh gosh, we're going to move them up in the agenda. It'll be actually earlier than that. We have upcoming, Dan Kilmer's going to be talking about our RFP that's going to be closing soon. We have Virginia talking about the Start Caregiver series that they're doing. We've got some things in the Alta events calendar that we want to promote. Um, we want to remind folks about the QIP surveys. And if we have time, we'll share about the groundbreaking that we had yesterday in West Sacramento for our new housing project, which was pretty awesome. So I am going to throw it to Michael Mercado, who I am going to spotlight right now.
All right, good morning, everybody. I'm going to start with the signs of the week, and we're going to be focusing on days of the week. Some of you might have a little bit of a challenge with these because these are related to the ABCs. So we're going to start with just 3 days of the week, and next week we're going to focus on the remaining 4, just so we can take some time to focus on these and their differences. We're going to start with Monday, then Tuesday, and Wednesday. Monday, this is an M hand shape. So your index, your middle, and your ring are on top of your thumb. And you're just going to move it in a circle. So this is the hand shape again. Your first 3 fingers are on top of your thumb. Then Tuesday is with only your index on top of your thumb. Move that in a circle, Tuesday. And Wednesday, you're going to touch, this one's a little bit harder. I'm actually going to do it with my other hand. Touch your pinky and your thumb. You're going to make that W and move it in a circle. So these are all going to be the same movements, Monday, Tuesday, Wednesday. The only difference is the hand shape. Does this feel challenging for some of you? I've heard it is from some folks. So you can have your palm facing the person you're talking to or your computer or your own body. Either way is correct. Okay, Monday, Tuesday, Wednesday. Good job. I know, those ones can be challenging. Yeah, it does kind of look like a clock. It's interesting, even though they're days of the week, not times. That's okay. Okay, Deaf Culture 101. This one is a little bit more interesting, I think. We're going to talk about the question, do our pets, do cats and dogs know that their owner is deaf? And this is something I've heard before. I think we all love cats and dogs. We all, a lot of us have pets, and a lot of people wonder if the owner is deaf, does the animal know, right? Will they be able to figure out that their owner is deaf? I think that pets often learn a lot and develop relationships with their owner, and I think that this is possible. Oftentimes, cats and dogs will make noises and they'll learn from the reaction of their owner, right? Whether that noise that they made was a good thing or a bad thing. And over time, those animals will learn that their meowing or their barking or walking into a room is not going to alert their owner. They will figure that out, that if they want attention by walking into the room, they need to go up closer so that the deaf person can see them or nudge them on the leg or whatever it is. So there will be different behaviors that are different between hearing owners and deaf owners. So if a hearing owner is making sounds, right, they're speaking, they're making those commands to their pet via audio, then they'll be able to know that. Cats and dogs are social beings, and they are communicating by barking and meowing, by tapping their toes on the hardwood, whatever it might be. And so when the owner is deaf, they will learn and develop that new habit of making eye contact, of nudging their nose or pushing their paws onto their owner's legs or lap, to say hello, I'm here. And this is something that will happen once the animal is adopted by the deaf owner, right? Their behavior is changing as the behavior would change in any new environment. And now specifically with cats, cats may meow, right? They may meow to say, hey, it's time for dinner. And if that doesn't get a response, then maybe that cat will come up and nudge them on their leg or jump on their lap. Uh, Cats and dogs are very smart, and they will be able to adjust their behavior to whatever is happening in their environment, right? I grew up with cats, and I did notice that our cat would sit in front of the TV and make eye contact. The cat would meow because my whole family is hearing, but me and one of my siblings is deaf. So the cat would meow, but I noticed that the cat would learn to come up close to me and they would meow again, but with no noise, and they would open their mouth really wide, kind of like telling me, hey, I'm meowing, even though they know they don't need to meow at me because I'm deaf. And so, in closing, cats and dogs may not know that their owner is deaf, but they know that certain behaviors aren't warranting a certain response, and they'll figure out how to get what they need to do and how to communicate with their owner. Especially if the owner is teaching them sign, if they're doing some sit, wait, outside, bathroom, things like that, that hearing people are also training with their dogs with those words. We'll do the same thing in sign language. Then those animals will learn those commands and be able to follow them in the same way if they were spoken in English. I do encourage you to notice a little bit more if you have cats or dogs about their behavior. That doesn't relate to anything that they may hear, or if you are silent, how does that change their response? Um, it should be an interesting. That's it for Deaf Culture 101.
Thank you very much, Michael. All right. I am now going to switch over to the California budget for folks, just to get this kind of knocked out right now. Is everyone seeing Google? Yeah? On my screen? Perfect. Let me set this up so I can see all you guys. So hopefully I don't get a weird AI answer and they just give me the link. There we go. California budget. All right, so you can see the posting of the California budget, and it has the summary and the detail, and the detail breaks down more specifically some of the numbers related to the budget. It's big for developmental services. I'm going to kind of go through it and show folks, how to find information in here. Before I do that, though, you can see that there is some time frames that are put on here, and I go over this typically every year. But we're just at the very beginning phase. After we look at what revenues come in April after taxes, there's a readjustment in May for the budget that occurs. And I have a little graphic that I have shared in the past that the Association of Regional Center Agencies puts out. But it goes from January, February, May. Typically before the release of the May revision, there's budget hearings that go on as well in the Assembly and the Senate, and then carries on, and then the budget is signed into law by June. So we've got quite a ways to go, but this is the first part of the process. And one of the things that jumps out immediately is how big the budget is specifically. And so I'm kind of going to Health and Human Services here and scrolling through. I'm going to make it a little bit bigger. Sorry, folks. How about something like that for people? A little bit better, maybe. Department of Social Services, they have their information. One thing that we've talked about in the past, and again, I just feel like it's important that you guys review like maybe the whole document, is that it doesn't just have to be impacts to the Department of Developmental Services budget directly, but other determinations that are made that are related sometimes impact whether it's education. There's a number of different realms that have crossovers. A big thing that jumps out to me is that the budget this year is 21.1 billion for the Department of Developmental Services in the state of California, which is a huge number. And that number is tied to the idea that we are going to have 527,000 individuals that are going to receive services in 26, 27, which again is just a huge explosion of growth that we've continued to see. They talk about their accomplishments in here, their funding for uh, Medicaid waiver billing. So what I like to do in these budget documents is again try to just review all that information that is contained within here. The budget starts off in as I say, January, and we'll get more and more information as we move through to this summer. So just wanted to share with folks where you can get the documents at, and I will drop it in the chat. There's going to be I think the Secretary of Health and Human Services, Kim Johnson's doing a press conference later today about this as well. If I can find that, I'll drop the link in the chat for you guys. But there's a little summary for folks. All right. Now I am going to throw it over to Dan Kilmer for an update about RFPs.
Thank you, John. So on December 19th, ACRC posted a request for a proposal. We are searching for a provider or providers to take over the operation of 2 of our community crisis homes in our area. These are state-run CCHs, and they work with multiple regional centers. The proposals are due next week on the 15th. We've already received a few. We are looking at getting those reviewed and interviews, and then with the final selection being in the first week of February. And then the hope here is to have the new provider in place by June 1st. So that's our goal here. And then I believe, Jordan, you are going to put a link into the chat for the website. Okay, perfect. Of the RFPs. Good. If anyone here is interested, there's the link, and you can review the proposal. If you have any questions, there's the RFP email box, and we will respond to that.
Awesome. Thank you so much, Dan. Shout out to all of Jordan's team that does these challenging developments. It is not the easiest thing in the world, certainly to develop these homes and on your guys' perspective to operate these homes. But we really hope that we can get a pool of candidates to choose from for this. So thank you so much, Dan. I'm going to throw it to Virginia, actually. Next.
Thanks, John. Thanks, Dan. Yes, so a couple of times a year, we are happy to announce the START team, the California START team, hosts a caregiver series. And this is a really great interactive series for providers, for direct support professionals, for any caregivers that you think could benefit from a little more education, a little more support. We know that the life of a caregiver can be sometimes difficult and exhausting. This group is set up to offer support and to be an active voice for our caregivers. So it is on Zoom, which is awesome. Begins on February 5th and runs through March 26th from 3 to 4. And the QR code is here. And I definitely will send out the flyer for those of you who are interested, and I will put my email in the chat. So if you are interested, you can just pop me an email and I will send this out to you. In the flyer is a curriculum of what will be covered in these groups. Something else to mention is that the groups, or this particular series, is available on the Zoom platform for up to, I believe, 14 different languages, including English. That is a really, really great thing to make note of. And they do have a capacity right now of about 30 participants, but we're hoping to grow that. So something to keep in mind. The START program also, when I was chatting with them earlier this morning, wanted me to mention that if you and your team look at this particular schedule and say, we can't really make this date or this time, please reach out to me because the START team can provide the training to an agency or to a group of people outside of this particular training series. So I thought that was a really great service, and we are looking forward to our folks taking advantage of that. So thank you so much. Thanks, John.
Virginia. Again, one of the things that our regional center is really prioritizing is caregivers, aging caregivers. Being able to provide people resources is something that, again, definitely is needed, and appreciate their getting everything translated into 14 languages as well, so that we can, have it widespread across our community. Thank you. Right. Quick Solver Plus. I think it might be time, Zeb. You get going there, and you can share your screen if you need to.
Thanks, John. Hello, everybody. My name is Zeb Gill with QuickSolve Plus. This is had an opportunity to interact with this group last year, and so happy to share a little bit more and share just a glimpse into a QuickSolve Plus, also called QSP. We are a software that is specific for the IDD space. We're in California, and we have so much SLS, ILS, CFS, HCBS features and emphasis in QSP. And I want to show you just a small bit of what QSP offers. It's really important for you to be aware of some of the tools and resources that are at your fingertips, especially a local resource. And so we can consider ourselves local with the goal of having really good documentation for the regional center. You don't want John's team knock on your door, during an audit. But if you do, you want to have peace of mind. And so with QSP, peace of mind is what you get when it comes to those compliance details. And so today I'm just going to walk you through 3 examples of how you can use QSP for some compliance elements. Hopefully you can see my screen. This is our web application, and specifically it hosts your client and employee data, helps you build schedules. I'm going to specifically go to the scheduling module real quick and just bring up an example of how you can craft a schedule to meet your individual's needs. This is the client view, and I'm going to focus on just an SLS schedule. Works for ILS. Any service type really doesn't really matter here. This is Stanley. It's just test data. I wanted to recognize the importance of the dashboard, which emphasizes how many hours you are slotted to are available for you each month. So this person has 600 hours available. We currently have 578 hours scheduled. The dashboard's a great tool to make sure that you are leveraging and utilizing all available hours. And so that will give a real-time update as the schedule changes. Because like many of you know, sometimes you put out the perfect schedule, but day by day, things change. Schedules change. People call off. They get sick, go to the hospital, etc. So the schedule changes with you. This over here on the right is this Redshift. This is a hole. We have all experienced a hole where a staff calls off shifts. So being able to easily identify that and even find coverage is another option within QSP. It's really important to know that as the schedule goes, so does payroll, so does billing, so does timesheets, so does daily service note documentation. All those really important pieces are all centralized. And so you're never going to have any data out of compliance because it's all coming from one source, which is the schedule. Now, flipping over to the employee perspective of the calendar, same schedule, just different way to look at it. We can see who the employee is working with this day. I'm going to use this as an example. Just today, Friday the 9th, this staff mate is working with an ILS shift, 8 to 11, and an SLS shift, 11 to 6. That may or may not be a real scenario, but it's one I want to highlight today. So let me open up my mobile app and just kind of show you a quick look at what the staff experience is. This is going to show you how EVV is captured as well. when staff open up the mobile app, they'll go to the clock module and be able to clock in and out for their shifts here. When clocking out for their shift, one thing I really like is a restriction that prevents staff from clocking out until they've done their daily service notes. We never want to have any gap in our documentation. So what a nice little way to remind staff gently that got to get those notes in. When it does time to clock in for a shift, I'll use this shift with our test client Porter Knight. One thing that is really helpful and one thing that is required for EVV, that's electronic visit verification, is capturing the location. And so in this instance, the staff indicates where they are beginning services. We'll just say Porter's home. If they are at the home, everything's gravy, baby. But if they're not at the home, QSP will say, hey, whoa, looks like you are not quite in range. We call that a geofence in the person's home. So there's some management things that you can do to figure that out. You'll get alerted so that you are always aware of where the staff is. Again, it's really important that we have an obligation to make sure our staff show up on time to their shifts, a commitment to the regional centers, to parents, to conservators, to circles of support. This is a great accountability feature as well. All right, staff's going to clock in, and I'm going to move on to my next example. All the data that's captured here, the clock ins, the geofencing, it all captures and holds directly into the database. Next up is notes. This is going to be a quick look, and then I'm going to bounce over to the client module. We can looking at notes. This is the note page. This is just like the schedule because we want every single shift on the schedule to have a note attached to it. And so this is where we can visually see where are any gaps in documentation. I'll focus on this shift right here with today with Jesse, 8 to 11, and just show you what it looks like to write down some notes that happened during the shift. And what's cool about this is that these notes, and I'll just use this form as an example, is connected to the person's ISP. So you can document specific objectives and goals that they're working on. So if this community resource was something that the staff worked on today, they can write notes about what occurred. I had some text I already copy and pasted, so I didn't have to make up something on the spot. So this is me typing in what we worked on with Jesse this day. It's always nice where you can kind of, again, if staff want to get long-winded, they can do that. And maybe that's the only thing that we worked on today. So I'm just going to say, we didn't work on anything else today. We just worked on community resources. So we're going to capture that. And that's going to go ahead and get logged and be part of the ISP. Writing progress reports and annuals is a big deal. So we want to make sure that is as seamless as possible. Mileage is an option. If you want to allow your staff to capture mileage, that's a tool. This is just a cool tool that allows to track distances between 2 points. I'm not going to go into that based on time, but it is a good one. Actually, let me do no just to kind of get through this. Because I do want to mention that when you are capturing a daily service note, staff signs, heck, you could have the client sign off as well. Definitely an option. It's just really good documentation. All right, daily service notes done. I can go ahead and finish clocking out, etc. Back here in the web application, I'm going to jump over to the client module because I want to look at those notes that we did for Jesse. And this is just going to be a way for me to show you the ISP. This is the client profile where you can capture as much data as you want. Within the ISP tab specifically, we do have an ISP template that I really like. It has some person-centered elements as well, which is just really speaks to the person-centered approach that we're trying to implement into all of our data here. You can see some examples of good day, bad days, likes and dislikes, etc. But we also can see the notes, the progress that this person is making on their objectives. And all this is tied into the ISP. So when we're ready, we can print this. We can make some changes, of course, to some of the data, but the ISP is ready to go. Whether it's a quarterly, semi-annual, annual, a lot of the data is there for you to maneuver and provide really awesome documentation to the regional center and to the circles of supports to really track what's going on with this person. Last thing I want to say here, it's definitely specific to ACRC, is some of the monthly notes requirements here. And jump over a different profile. I know this is a common for several programs. Specifically, we're going to look at just a SLS example, though it could translate to any department really, is this expectation for monthly notes. I like this one because when you're doing that reporting at the end of the month, it's a real quick, simple click to get that data. Like anything, good data in equals good data out. So here we just have a nice report that's clean, updates as needed, that tracks what's going on this month, lists allergies, any doctor's visits that occurred during that month, current list of medications, contacts, etc. This person has a lot of medications in my example here. Were there any SIRs that happened during that month? It lists it there. QSP is not going to be not going to submit special incident reports for you, but you could definitely use them to document for your reference. Medical contacts, agency contacts, important contacts, all there for you and for the regional center. All right. A lot of other pieces of QSP. My goal today was to share with you just a few elements that can really make your whirlwind die down and be more centralized and streamlined. Would love to provide an available resource for you, and I'll put this link in the chat. We have on our website some ebooks, some free ebooks. I like this one. It's the ISP playbook. It's just tips for writing a person-centered ISP. I want to give that resource available to you. So I'm going to drop a link here in the chat that you can go and grab. You can grab any of these. Like most things, that we just need your email address to send it to you. And if you are interested in any further details, I'll put my email in the chat as well. Please feel free to reach out for a demo or more information. Happy to provide that. Thanks you guys very much for your time today, and happy to answer any questions.
Folks, we got plenty of time. All right. Well, then I would say thank you very much, Zeb. I appreciate it. Again, we recognize that you all have increased costs as it relate to overhead, and sometimes these smart technology solutions can be impactful on kind of your bottom line as businesses. And you can see that they've put a lot of thought into trying to ensure that they get very clear documentation, and it's certainly very well aligned with our regional center expectations. So thank you very much for that, Zeb. And I see Brandy's comment in there that she wishes she would have had this years ago. So good stuff. Really appreciate that. All right. I'm going to throw it over to Michelle Duchesne.
Thanks, John. Let me share my screen really quick. I just wanted to remind everybody, I know we've shared on this. You seen the DDS website? Thumbs up, somebody. John, are we good? Yes. Okay, perfect. So we're coming down to the deadline for the QIP requirements for fiscal year 26-27. The deadline to be fully compliant is January 31st. So I wanted to give you guys some tools. The department has developed a page for you that I want to kind of share. So on the home page, you would go to vendors, and then you would scroll down to quality incentive programs. And the department has developed this page for you. So what this does is it gives you a summary of really what those QIP surveys are, what's being collected. These will actually take you to flyers for that. And I can click on that in a minute, but I want to make sure we stay on this. But this will just give you the details of what's all of the questions that they ask within those surveys. You'll see over here the provider, they've actually created a checklist for providers to utilize, which does show all of the pieces that are needed for everything that is required for the quality incentive. So there's check marks for, and I'll pull those. I'm hoping that we share it. It actually shares that screen once I select it. But what I really wanted to share with you guys as you go through these for the quality assurance trainings, they are all right here with the slides and the recordings. The webinars are really, really detailed for you. They go through step by step every single piece of these surveys. So if you have questions, I recommend watching these. They're super thorough for you. But as you come down, you'll see right here again, this will kind of tell you some summaries about those QIP requirements. But this is the big one right here, provider survey status. So this is going to be the one that you're going to want to go to, and we'll put a link in the chat. If you scroll down, this is going to show you where you are with those requirements. So this is, and I'll click on this and show you, but there's going to be one for the QIP surveys. There's going to be one for the electronic verification requirement, the independent audit, your fiscal audit. If you were required to do that, it's going to show you the current status of that. So let me select one. I want to make sure. Are you guys seeing the Excel sheet? Does that look good? Okay. So what you can do here is you can come and we can sort by regional center. So you can apply to anyone that you guys are tied to. And you'll see right here, it'll have the different surveys. So it has the prevention and wellness, and it has the capacity and also the employment. So based on your vendor number, you can go ahead and look and see if it is complete, if it's not required, or if you'll see down here, some of them say not complete. So you guys will be able to go on. The department has let us know that they are going to update this report every Monday through January. So the last report will be probably the first, I think we calculated on the first Monday of February, which was the 2nd, I believe. And that's when we will be required to pull these numbers and start calculating them for the fiscal year rate increases for the QIP. Let me get out of there. Again, if you go down to the independent audit, you select that. You can go ahead and again, select the vendor, the regional center, and it'll tell you right here, these are all the ones that the department has determined are required based on the funding amounts for the year. And so you can go on here and look and see that yes or no, they are not complete at this time. Again, our regional center is, we've reached out and received a lot of those. We are sharing all of those with the department. We are finding that some are, we're having providers reach out that they submitted and that it's showing no on the actual survey status. Please reach out to me. Let me know. I'll put my name in the, my information in the chat. We will reach out, confirm with our accounting that they have received it. And then we will include you in an email to the department, just letting them know that we show that we have confirmed to receive those. QIP questions at dds.ca.gov is the email. If you guys have any questions, if you realize that a survey has been locked, you can't access it. If you're a residential facility and first, though health and wellness is required, if that wasn't sent to you, you can always CC your specialist as well so that we can follow up. But I'll put those in the chat and we'll just keep doing some reminders for you guys as we go through the month of January.
Thank you very much, Michelle. Again, as we say, we're going to be doing reminders. It's very important for us that you guys are able to retain the QIP portion of your rates. So thank you very much. Speaking of rates, there have been published by the Department of Developmental Services. And so I'm going to go to their website real quickly and share that information with you. So there, let's see. We're seeing the website, right? Perfect. Okay, so we're going to go to vendors, and we're going to go to rate reform. And we're going to go to rate models and rates. And actually, this is an update even like for today, is that, oh, that's interesting. They were there this morning and now they're gone again. The rates have been posted for this year. They include the minimum wage increases, so they're right there. Additionally, California law required the Department of Developmental Services to update the rate study and conduct a rate model review. Let's see. I don't know if Eric is on. I know that I heard that he has taken a look at this for the rate models, and I'm sure he could probably explain what these are better than I am. But Eric, can you just kind of share with folks what this is and then what it kind of means, like, as far as authority to implement it?
Sure. So it can be confusing because there's two new rate models that have been released. The rate models that are implemented really just have adjustments to the minimum wage. And that's what you're going to see where John's pointing. You could download those models. I have, if anybody wants, I did a side-by-side of all of our rates that we had, the previous rates from 2025 and then the new rates, and you can see exactly the percentage dollar difference between those rates. They range from a fraction below a 0.5% increase to about 3% for adult residential facilities, the lower levels. So that's sort of the range that's already enacted for January 1 of this year. Then the AB 2423 models is a different rate model. That's what I created that has if you want to take a quick look for if you provide services, you want to take a look. The new 2026 rates are on the left. The previously released 2025 rates are on the right. And then you can see the comparison in the middle. Green is over 2, white is in the middle, orange, yellow is below 1%, just to get you an idea. Since you're there's a few things that have been removed. So you can see on the right, the transportation broker non-ambulatory rate has been removed. If you go to the respite section, you'll see a behavioral respite model was added as an example, which was a surprise when we saw those new rates. And then there's a few more mileage rates at the bottom. Those are some mileage rates for folks for the excess mileage directive that were added. So
they did it for PA. Excellent.
Yeah. I was going through. There were some surprises, but those 4 rates and the behavioral respite rate were surprises. So I in going through those, found those differences. So
I thought we were rolling towards like an enhanced respite idea rather than a behavioral respite idea, but it looks like
we were,
it's official. It's going to be behavioral respite.
I
just say I would note on care homes significant increases in a number of areas too. So
so you can see those green dots there. That's the highest rate increases. Is the level 2 staff residential facilities are just over 3%. And then there's the behavioral respite model, which again, we knew the DDS was working on these. We did not think they were releasing them. So we were surprised to see those in the model. We'll have to ask some questions. Are they really authorizing that? Is this live now because it's in the model? We were told it was not going to be implemented soon. So we're a little surprised on that one, but more to come.
So Jordan, DD's only been waiting like 2 years for those rates to come out. So there we go.
I literally just messaged her about it. Thank you.
Awesome. Yeah, that's been a long project and a lot of advocacy. Anything else we want to share about this other than, well, maybe you can just explain what this means now that we have these.
What this means, what it means is, as I understand it, you can correct me if I'm wrong, but the January 2026 rates are all funded.
Yep.
So that's going to be the big difference between the other model. So these are funded, these are adjusted because of minimum wage, and I've not seen anything in the governor's budget, because I've been looking at that to see if they were going to make adjustments to this fiscal year through the end of June 2026. And I saw no changes to these models. So it looks like to me that these are enacted, unless you know something different.
No, at this time, I do not know. I know that we're going to get a little bit more analysis when the full budget proposal description comes out. But I was looking at it briefly. So that's the thing, folks, just to clarify, they were successfully able to get the department to update the rates and publish them, but there has not been legislative action to implement these new rates yet on the right-hand side of the screen that we're showing there. It's just the ones. But that being said, the behavioral respite has been added in, and that is something that is new to us, and we've been trying to kind of get that figured out. So just wanted to touch on those real quickly for folks, and you can find the information from the rate models.
No, but AB, those rates are different, John. We didn't talk about the AB 2423 rates. Those rates, these are models that advocates got passed to require the department to post models that update more than just the minimum wage requirements and other cost factors for providers to get an idea of how much more a fully updated rate would cost the department. So those rate models can vary from 3, 4, 5, 6% to 20-something% difference between our current rates for the AB 2023 model. So these are really just for reference for DDS and providers and the legislative reference to see how much more money it might cost to fully update those rates, not just on the minimum wage issues. So that's a different rate model, and you'll see increases very different from what we just proposed for the enacted rates.
Again, rate models posted on DDS's website. What we learned from our accounting department is that your authorizations that you received for the month of January are going to have your old rates, but when you go to bill at the beginning of like February, it'll have the updated rates on them. Our accounting department has been implementing them, so they are going in. All right, now we've got 12 minutes. We can cook through a few different things here. Wanted to share that our newsletter is out for people, and don't know why it's not letting me copy it there, but it's on our website. And can everyone see that okay? Our Alta Connections newsletter. So again, being able to celebrate a number of awesome things that went on over this last quarter at our regional center. You can check out all of our outreach activities that we do. We have a very active outreach group that goes to activities all over our catchment area. And so very pleased. We've got our team that did the My Sister's House run as well on here too. There's a story about the People Planning Together training and a picture of Reva Johnson doing some speaking at Sac City Unified School District. We celebrated our work staff anniversaries, including Helen Neary as well. Congratulations to our staff that had their anniversaries. We had our Employee of the Month, who some of you may recognize these folks. Got Wendy on here. We got Beth Argo on here, who works with individuals that have been in the hospital on protracted stays. We have a great story here about our first emergency resource fair, and kudos to our staff that worked on getting this thing set up. And you can see Hubert and Michael right there, but really a diverse group of different services. We had some assistive technology services as well that were available to share at our office here. So this is something that we're really hoping that we can continue to do at our regional center, and again, really enjoy doing that. One of the questions that people have is sometimes about what kind of trainings we have as regional centers for our staff. And so highlighting our trainings, there's an attachment at the end of this that goes over all the trainings that we did at the year, but this one's kind of cool. This is Dr. Lori Eldridge doing a training to a number of our lead service coordinators. I think we got manager in there too, as well, talking about substance use disorder treatment for people with developmental disabilities. We had our Capitol tree lighting, and so very pleased to have all those ornaments that were donated by you all on the tree. They were fantastic. We tell folks that they don't get their ornaments back, but I will say that we did actually grab, I think, one or two because they were really, really special. So thank you guys very much for getting the ornaments together for Alta's Christmas tree. We're continuing to have listening sessions. When I run over to the events calendar next for Alta, you'll see that there's a number of them coming up. And so when we post these opportunities, we just want to encourage you all to talk to clients and families, encourage them to attend. These conversations are important for us to hear what's going on all across our community. So we've got those, and they're right on our calendar to get that information. I don't know if we have anyone from Sunshine Day Program or if Miss Priscilla Holmes is on or not, but we received some awesome pictures. I think it was Shauna that might have given this to us, but they did a fashion show and at their day services, and just fantastic pictures. I love like all the smiling faces. I love the creativity. And so when you guys do things like this, please share it with our community services staff, especially if it's something that you like tried out and like now you want to do it in the future. So anyways, I love focusing on stuff like this. So thank you guys very much for sharing those pictures. Thank you for being really creative in what you're trying to do to support people in their day services. At our regional center, we are continuing to do significant outreach to make sure that even though we have some remote activities going on, that we get signatures for all of our IPPs. So included some information in there. I don't know if people are familiar with this free service, Bright Life Kids. but they have some really good counseling opportunities that are available, and I think it was all free as well. And if you go to our, you can click and it'll open up the App Store, and you can download their app directly from our newsletter. There we go, or Google Play. Again, who should you call in need of assistance? This is a reminder for all of you. You got 105 folks on, and about 85 of you are service providers. If you don't have an authorization for services, you should not be providing services to that individual. There is no assurance of payment of services unless you have an active authorization. We're going to be refocusing on this as a regional center, but one thing I need to ensure you are all empowered to know is that you can elevate this issue. For us, we really need to have the service coordinator contacted. I would just ask all of you, please include their client services manager with them if you are asking for something like an authorization. And if you're not getting responses, I encourage you all to continue to elevate it. Every email that we send out has who our boss's contact information is. And if you haven't received information back, you can reach out to that person. But for authorization, like if you have a renewal that was supposed to be done of an authorization and you don't see it in place, we need you to reach out to the service coordinator and their manager immediately so that we can get the authorization in for folks. So it's just a reminder to please check your authorizations before offering services. And I will acknowledge that there are a significant number of retroactive purchases being authorized. And so we're working on that. But as a reminder for you as service providers, you need to have that authorization in place before offering the services. Please do not hesitate to elevate your concerns. Some of you remember Peggy Rossi. She was our nurse at Alta, and I like this because it ties into what Virginia was talking about a little bit earlier with our caregiver importance. So for our clinical corner, she wrote a little editorial here about caregiver, a role we least expected. And so she's got some tips and tricks in her information there. And then we have a link to our activities for coordinated future planning, which is our kind of caregiver succession planning information. Santa Day, just want to acknowledge again all the awesome work that went into putting on Santa Day. We had a fantastic time there. I was able to make it over to the Scottish Rite. I don't know who designed these tote bags that we gave out, but that was like the coolest design ever. Thought that was pretty special. Really, again, shout out to our staff that did a number of different booths as well for our event. We had our clinical team out there. The Tooth Fairy, our dental coordinator, was out there. So again, really appreciate it. We had, I would say we must have had over 1,000 people that came through during that day. And we really appreciated that location as well. So, and thanks to some of you that also helped out in volunteering for it from the community services staff. There's an article in here from Michelle Johnson talking about our continued growth of our aging population as well. So again, when you're looking at offering services to our clients, things to be mindful of is this is the oldest kind of generation of folks with developmental disabilities right now that we've ever seen. And so being able to tailor opportunities to individuals is really important. And so just be mindful of that. We're going to continue to see, I know, our numbers grow. And there's a number of reasons for that. We have much better health outcomes, and we don't institutionalize people like we used to that have developmental disabilities. Those are big impacts on longevity. I want to shout out our community services staff who, and I will say there's an update to this, they did 331 new vendorizations in the last calendar year. That is a huge number of new vendorizations to do while we are concurrently, in essence, updating rates for 2,000 service providers vendor numbers. And so you heard Michelle Duchesne mention a little bit earlier about residential, but a residential care home development has exploded in our area. The amount of applicants that we get is really, really significant. Areas in the past where we had big gaps in services are now being completely filled, and many of you are running into challenges being able to support your businesses because we don't have enough referrals to give providers. So again, it's fantastic having choice and being able to offer that, but we also recognize that our charge as a regional center is to vendor everyone that qualifies and is in alignment with statute and regulation. And so I just have to acknowledge our staff who did such an amazing job this last year, like implementing the rate study stuff that has been so hard, but then also being able to do all these new vendorizations and offering all these new opportunities to our clients has been amazing. So thank you guys very much. Awesome work this year. We love, and again, I will shout out Shauna, who also works on this, and I really appreciate being able to focus on our artists in our community, people that do micro enterprise. And so Neighborhood Center for the Arts up in Grass Valley, once again, we're focusing on another artist, and I just want to encourage you to check out her work there for Christina. And this is just, again, a listing of our staff trainings that we did in the last year. If you have an interest in knowing what kind of trainings that we do for our staff and for our managers, this is a listing of the ones that we had over the last year. All right. Real quickly, I'm going to just go over the directives that we received since we had our last meeting. So one of them is related to and I did go over this during our provider advisory committee meeting briefly yesterday, but reporting requirements, best practices for ethical use of generative AI within regional centers. There is guidance for service providers as well, and expectations, in essence, that you guys are going to be held to the same standards that we are. Encourage everyone to take a look at that. We need to incorporate some of this language into your agreements with the regional center per the directive. So we will be working on that. Additionally, there is finally, oh my goodness, Scott, we have been waiting forever, and Alicia and Kylie, the folks from our HCBS team, to finally get the instructions from the department on what we are going to do for our upcoming monitoring and reporting of HCBS compliance. And so this information is additionally available within the directives. In short, we are working on developing our plan over the next 3 months. You are all HCBS compliant right now. We recognize that HCBS compliance is a factor when it comes to getting your quality incentive payments. And so we are working on a plan that will not duplicate our efforts. The department is allowing a range of different activities to be counted as appropriate for monitoring. And so again, we'll be sharing a plan that we're going to be putting in place. And again, this document goes over some of the different settings that are required for the monitoring as well. So we'll be talking a little bit more about that. Additionally, there was one other directive that I just want to mention, and we're going to go more in depth in, and that is regional centers have to start preparing themselves, and service providers do too, for the new SIR reporting requirements that are coming in. And so we're going to probably have to do we'll probably do like a special meeting to go over that with everyone. So we'll advertise it, the Coffee with Community Services that specifically goes over what the new requirements are, so that and we're also concurrently updating our own training materials at our regional center because now we have new special incident categories that we're going to need to be reporting to the state. So that's coming up as well. I'm just going to check the chat, and yes, the updating the vendorization process. I know we talked about it briefly at the PACT meeting yesterday, and I wonder if Michelle, you can drop that in the chat for folks real quickly, because we are moving over to the new statewide standardized vendorization effective right now. And so there's some new instructions for people that are interested. So let's say you want to do a new vendorization with Alta California Regional Center. We are going to encourage you to go to our website and go through that route. And then we did give everyone at the Provider Advisory Committee meeting yesterday a little preview that Michelle and our team of managers and staff are going to be front loading Alta's website with a lot of the vendorization information that you're going to need, like what's required for your program design, what are the special documents you need to have on hand, which we believe is really going to help streamline the new vendorization process. So some of that's going to be coming a little bit more in the future for folks. All right. I hope everyone has a great weekend, and thank you so much, Zeb, for the presentation, and Dan and Virginia and Michael and everyone else. So thank you very much. Have a great day.